Well, joining us on the phone now with more information on the case that we told you about at the top of our newscast is Michelle Burnett. She is an epidemiologist with the Norfolk Department of Public Health. So, Mrs. Burnett, thank you for joining us. What more can you tell us about this case?
Hi, Kurt. Thanks so much. We really appreciate the opportunity to talk with our community. As we had mentioned in the information that was sent out earlier, it is a 50-year-old, a gentleman in his 50s, and this is the first case that has tested positive in Norfolk. What's really important is we must focus on reducing the transmission of the virus. Things like social distancing play a big role in reducing virus transmission. Washing your hands is very important for at least 20 seconds. If you don't have soap and water available, hand sanitizer is just fine to use. It's also important to avoid touching your eyes, nose, and mouth. Also think about those frequently touched surfaces that might be in your home. Those need to be clean and disinfected. And most importantly, if you are sick, please stay home.
All right. So back to this case. Your office said that you don't believe this was a case of community transmission, which they're also saying is community spread. Why do you believe that?
We think that our case was in contact with a person while traveling outside of Virginia.
All right. People hear this and they got to be a little freaked out, that it's now in Norfolk. What's your message, real quickly?
Wash your hands, stay home when you're sick. I know that this is our first case, but it is likely that we will continue to see cases as well as the communities that are surrounding us as well.
All right, real quickly, you don't believe this guy has had any other contact with anyone else in Norfolk?
Well, it's important to focus on reducing disease transmission, so things like social distancing, staying home when you're sick, and we believe that this person has been isolating himself since his symptoms began.
Okay, Michelle Burnett, she's an epidemiologist with the Norfolk Department of Public Health. Michelle, thanks so much.